Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Baclofen Pump Introduction. Spasticity or abnormal tightening of the muscles can greatly limit your ability to move and work. If other treatments fail to control it, placing the drug baclofen around the nerves in the spine may relieve the spasticity. Baclofen is approved by the FDA for this use. A baclofen pump placed in the body can be very effective in controlling spasticity. Doctors may recommend surgery to place a baclofen pump in the body of a patient suffering from severe spasticity. If your doctor recommends surgical treatment for your condition, the decision whether or not to have surgery is also yours. This program will help you understand better the benefits and risks of this surgery. Anatomy. The spine protects the spinal cord and nerves that go to different parts of the body. The spine is formed of solid sections of bone called vertebrae. Nerves travel from the brain down the spinal cord and through the spine to the legs and all parts of the body. When the brain orders body parts to move, or if it gives other orders to body parts, these orders are carried through the nerves. These orders travel by electrical impulse in the nerves. The nervous system is usually very coordinated. When it orders a muscle to tighten, it causes the muscle that opposes it to relax. For example, if you want to straighten your leg at the knee, the brain orders your quadriceps muscle, the muscle located in the front of the thigh, to tighten. At the same time, it orders your hamstring, the muscle in the back of the thigh, to relax. Symptoms and their causes. Spasticity or abnormal tightening of the muscles can happen in different situations. Multiple sclerosis is a disease of the nervous system. It may cause the muscles to become very tight and very difficult to relax. Spinal cord injury can also result in spasticity. When a person has spasticity or is spastic, she or he is unable to relax the muscles. This can cause problems with moving or using limbs. It can also cause pain. However, some patients with severe weakness are able to use the stiffness that comes with spasticity to their advantage. The stiffness can allow them to bear weight and walk, for example.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Alternative treatments. A baclofen pump is recommended only when the spasticity is severe and cannot be managed by regular medication or other treatments. This type of treatment for spasticity does not help in all cases. Baclofen is a medication that is very often used to treat spasticity. It is taken by mouth and, along with other muscle relaxants, can be used to help the patient overcome spasticity. Physical therapy, occupational therapy, and other forms of therapy can help the patient relax and cope with the spasticity. At times, if a specific muscle or muscle group is very tight, the physician may suggest injecting that muscle with Botox. Botox paralyzes the muscle for a period of weeks or months. It helps relieve some cases of spasticity. Rarely, an operation to cut the nerves close to the spinal cord may be proposed in some patients. This operation is called a rhizotomy. A Baclofen pump placement is not as drastic as a rhizotomy. Surgical treatment. Before doing actual surgery to implant a Baclofen pump, your doctor will give you a test dose of Baclofen through a spinal tap. This is done to make sure the Baclofen helps reduce the spasticity. It is also done to make sure that you can tolerate the Baclofen without any nausea or allergic reaction. The operation can be done under either local or general anesthesia. This depends on your doctor's preference. The pump will be placed under the skin of the abdomen and connected to the spine by a tube called a catheter. First, an incision is made in the middle of the back. A catheter, or flexible tube, is inserted from the back incision down to the spine. X-ray pictures are used to find the best place to insert the catheter. To place the Baclofen pump, the second incision is usually made below the rib cage in the front. Your doctor may recommend a different location for the pump. The Baclofen pump is placed under the skin in the front. The spinal catheter is tunneled under the skin from the incision in the back to the incision in the front, where it is connected to the pump. All incisions are closed at the end of the operation. The whole system is under the skin. It may not show at all under regular clothes, but it may bulge under fitted clothes. Risks and complications. This operation is very safe. There are, however, several risks and complications which are unlikely but possible. You need to know about them just in case they happen. By being informed, you may be able to help your doctor detect complications early. The risks and complications include those related to anesthesia and those related to any type of surgery. Risks of general anesthesia include nausea, vomiting, urinary retention, cut lips, chipped teeth, sore throat, and headache. More serious risks of general anesthesia include heart attacks, strokes, and pneumonia. Your anesthesiologist will discuss these risks with you and ask you if you are allergic to certain medications. Blood clots in the legs can occur due to inactivity during and after the surgery. These usually show up a few days after surgery. They cause the leg to swell and hurt. Blood clots can become dislodged from the leg and go to the lungs, where they will cause shortness of breath, chest pain, and possibly death. It is extremely important to let your doctors know if any of these symptoms occur. Sometimes the shortness of breath can happen without warning. Getting out of bed shortly after surgery may help decrease the risk of blood clots in the legs. Some of the risks are seen in any type of surgery. These include 1. Infection, deep in the spine or abdomen or at the skin level. 2. Bleeding. 3. Skin scars that may be painful or ugly. Other risks and complications are related specifically to the surgery. These again are very rare. However, it is important to know about them. Spinal fluid may leak from around the nerves and cause a headache. An infection called meningitis may happen around the nerves and spinal cord. If you notice high fever, headache, and extreme tiredness, call your doctor. There is a very slight chance of weakness or even paralysis. At times, the Baclofen relaxes the muscles to such an extent that if the patient depended on some muscular stiffness to be able to walk, she or he may not be able to do so. In these cases, the dosage of the medication may have to be reduced. There is a slight possibility of new bowel or bladder dysfunction. However, this is very rare. Other risks specific to this surgery are related to the use of a mechanical device. The catheter may pull out of place or break and have to be replaced. The pump may stop working or become infected and have to be replaced. The battery lasts 3 to 7 years, after which the entire pump may have to be replaced. In extreme rare cases, scar tissue can form at the tip of the catheter around the nerves and spinal cord. This scar can become big enough to put pressure on the nerves or spinal cord. It can cause pain, weakness, and possible paralysis. In these rare cases, surgery is often needed to take that scar tissue off the nerves and spinal cord. The body may get used to gradually higher doses of baclofen. It is therefore very important to stay with the lowest possible effective dose. If the body gets used to more and more baclofen, the drug may stop being effective in controlling spasticity. The longer the patient expects to use the pump, the more important it is to keep a dose low. After the surgery, no repetitive bending or twisting or heavy lifting is allowed in the few weeks following the operation. After this period of relative rest, physical therapy may be necessary to allow you to resume your previous activities. Whether or not you will be able to resume all previous activities depends on how well you are doing at the time of your follow-up. Your doctor will tell you how long it will take before your back is healed and when you can go back to work. This depends on your age, type of work, and medical condition, as well as other factors. The pump needs to be refilled with baclofen every few months depending on how much of it is used. The pump is entered with a special needle through the skin. Refilling does not hurt. There is, however, a small needle prick. The pump can be programmed from the outside to deliver the desired amount of baclofen to the nerves. Remember, it is important to always use the lowest possible amount of baclofen. Your pump has a low-volume alarm, which will go off when it stops working. It also goes off when the pump needs to be refilled with baclofen. When the supply of baclofen to the nerves is cut off, you may have withdrawal symptoms. Withdrawal symptoms could include feeling ill with flu-like symptoms, fever, and itching. Rarely, withdrawal symptoms can be life-threatening. If you hear the alarm, have worsening spasticity, or feel suddenly upset or nervous, call your doctor or an available doctor right away. You should tell your family to call a doctor right away if you become too sleepy and difficult to arouse. You may be having an overdose that could be deadly. When you pass through a metal detector, for example at an airport, you may set off the alarm. It is important to carry your registration card with you to prove you have an implanted medical device. You should tell all your healthcare providers that you have a pump. This not only includes doctors and nurses, but also chiropractors, physical and massage therapists, pharmacists, and other healthcare providers. Some treatments and procedures may need to be changed or may be dangerous for people with a pump.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Baclofen pump placement can help relieve your spasticity when other treatments fail. This operation is safe with good results. However, as you have learned, complications may happen. Knowing about them will help you detect them early if they happen.
Thank you for using Explain.